Hey guys, it is Dr. Cree, and thank you for joining us for this edition, the latest edition of the Dr. Cree and Me Show. So I want you to come on in the room, kick up your feet, and let's talk, okay? Let's talk. Make sure to share it on your pages. I'm going to share it on my other pages as well, and we'll get started. Hey, Miss Pam, we will get started. So share it, like it, pass the word on. We got a lot to talk about. When you get here, make sure to leave your name and tell me where you're watching from. And can't wait to dig into this. This has been a big topic of discussion: high blood pressure, strokes, and coronavirus. So we'll jump in just a minute. I hope you guys are having an awesome day. And I hope that we get to the bottom of this. Hey, Montez. So share it so we can get as many people informed as we can, okay? Hey, Miss Drake. All right, gotcha. All right, so let's get started. You know who I am. I am Dr. Cree. I'm a board-certified family medicine physician, and I specialize in helping overwhelmed, overworked, everyday people learn how to educate themselves on the issues that are affecting our healthcare system. Hey guys, thank y'all for joining the latest edition of the Dr. Cree and Me Show. And I wanted us to kind of tackle high blood pressure and strokes, okay? And how it is relating to things that are the coronavirus. So thank y'all for joining. Please share the broadcast. Thank you. Thank you so much. You said you love my shirt. So welcome. So this week I felt it very important for us to talk about high blood pressure and stroke. So I'm going to give y'all a bunch of information. My note takers, I want y'all to be taking notes. So when people come back and watch the broadcast later, they can get the gist of it. So let's talk about high blood pressure and what happens with it in the setting of the coronavirus, right? So high blood pressure, just as a review, number one, high blood pressure is greater than 140, your number on the top, over greater than 90. Hey, David, you made it. Greater than 140 on the top, over greater than 90. At least twice. We did a whole show on it. So we're going to go back and review. High blood pressure is greater than 140 on the top, over, greater than 90. So you may have, so mind you, let's do an example. Your top number may be 130, but your bottom may be 95. So that's a high blood pressure reading. Your top one may be 156, but your bottom may be 80. So that is considered high blood pressure. Hey guys, thanks for joining. So number one, let's just remember what high blood pressure is. And for evidence based, we know that you have to have two high blood pressures. Okay, two high blood pressure readings to meet the definition of having high blood pressure. So essentially anything over 139 on the top and anything over 89 on the bottom. So number one, high blood pressure is anything over 139, anything over 89 on the bottom, and that is on two different readings. That is hypertension. Okay, so just a quick review. So people that are having high blood pressure, remember you're at risk for a lot of things. People with high blood pressure, you're at risk for having strokes already without coronavirus. You're at risk for having heart disease already without the coronavirus. You're at risk for having heart attacks already without coronavirus. So even by itself, you're at risk for all these things: stroke, heart attack, heart disease. You're at risk for those things without coronavirus. Then you add coronavirus on top of that, it heightens your risk up even higher with having strokes. And we'll talk about that a little later. So just remember, at baseline, you got your own risk, right? Hey guys, thanks for joining this edition of Dr. Cree and Me Show. We're talking about high blood pressure and strokes as it relates to coronavirus. So number one, high blood pressure is any number on top that's more than 139. And then on the bottom, it can be any number that's greater than 90. Okay, 89 or up, so 90 or higher. Number two, high blood pressure is a major risk factor for strokes already, whether you got coronavirus or not. It's a risk factor for heart disease. It's a risk factor for heart attacks. So you already at risk for that. Now coronavirus makes it a little bit more janky, okay guys? So number three, high blood pressure plus coronavirus can lead to a lot of dizziness, okay? A lot of these people have dizziness, they have lightheadedness, and they can just faint at the drop of the hat. So if you all of a sudden start to have dizziness, you all of a sudden start to have lightheadedness, and you lost your sense of smell, you need to be checked for coronavirus, right? So I think that we talked about this before. We talked about how a lot of people were just talking about the respiratory symptoms, just talking about coughing, just talking about wheezing, just talking about those symptoms and the fever. But mind you guys, we're having people that are not necessarily presented with those traditional coronavirus symptoms, and now we're having strokes with no coronavirus symptoms that we know of. The lesions on the foot, the red, itchy, swelling lesions on your foot, the GI symptoms, that's diarrhea, that's watery diarrhea, diffuse watery diarrhea, that's dehydration, that's losing your sense of smell. So remember that all of that, when you think of coronavirus, you got to think outside the box, guys, okay? Think outside the box. So number one, we remember what high blood pressure is. Number two, high blood pressure puts you at risk for a lot of things at baseline. But high blood pressure plus coronavirus can lead to a lot of lightheadedness, a lot of dizziness, a lot of fainting. So next, if you have high blood pressure, and in this coronavirus time, I implore you to go buy a blood pressure cuff. Well, we can't find them anywhere. Check online, check your Amazon, check your maybe a couple of days out before your delivery. But make sure you got an electronic cuff. You can even measure your circumference of your arm here and make sure you're buying the right one, because if your cuff is too small or if your cuff is too big, you can get inaccurate readings. So get you a home blood pressure cuff. You can get the blood pressure cuff from anywhere, just as long as you have one, and get used to using it, because if you start feeling bad, you get those fevers, and a fever is greater than 100.4, remember? So get you a blood pressure cuff. Now let's get into the nitty gritty. So coronavirus attacks the lungs. So your lungs are attacked. Your lungs get inflamed. You get inflammation of your lungs. Your lungs fill up with fluid. So now that's where you can't breathe. That's where you're hearing the wheezing. And then your blood is not able to be oxygenated the way it should be, because you're not getting enough oxygen anywhere, because you're filling up. Imagine you're just filling up with fluid. So the more fluid you have is a byproduct of the inflammation that you have in your lungs. And because of the inflammation, the blood, your blood, is not being oxygenated well. So the role of the lungs is to get oxygen everywhere. So imagine if we don't get oxygen to our little toes can fall off. You don't get oxygen to your brain, you have strokes. So it is, the lungs are very, very, very important, right? So we need to oxygenate as best we can. But when coronavirus comes along, inflammation is in overdrive. So imagine, like, if you're older and you have arthritis in your knees, or if you have arthritis in your hips and you have arthritis in that back, and the pain that you feel from that. Arthritis is an inflammatory process, and imagine having that going overdrive in your lungs. That's scary, right? And then the idea of the feeling of drowning, and the idea of, like, oh my gosh, I can't breathe, and therefore your body's not being oxygenated. So because of the decrease of oxygen to your blood, then your body begins to say, this is the perfect setup to have more clots. So clots can begin to form. And then you get this overabundance of clots, or you can get what we call disseminated clots, so DIC. You can have clots where your clotting factors, the things that if you get cut, your body automatically knows how to protect you by clotting up. Well, that system goes haywire, and then you clot so much that you end up just bleeding out. So it's like in my day, we was something that we didn't see a whole lot of it. Now people are seeing a lot. Have you guys seen that Broadway actor that had to have his limb amputated because he had a clot? And a lot of people were like, oh no, that's because he laid around for a long time. That's not the case. We're finding out that either coronavirus itself is attacking the vessels, or all of the inflammation that's inside of the vessels from your body being in overdrive trying to do what it has to do is causing these clots. So the clots then can form a DVT, which is a blood clot to your veins, usually in your legs, or arterial clots that also can be in your legs, your foot, your limbs. It can cause heart attacks. It can cause strokes. So that is kind of the premise of it. Your body's not getting the oxygen that it needs. The blood is not being oxygenated effectively. So and you laying down. So you're setting up the perfect storm to have clots as it is. So the virus, next, coronavirus is seemingly attacking large vessels, right? Large vessels that go up to your brain. So these are the vessels that supply and control the movement areas of your brain. It controls the thinking areas of your brain. It can control your breathing areas of your brain. So imagine you get a big stroke here, and that controls your breathing. So you throw the clot here, you can't breathe. Or it may be that it goes here, and the clot breaks off, and then you have a combination of those symptoms. You really can't breathe good. You're dragging your leg because you can't walk, and you can't think to coordinate it all together. So I know this is a little bit technical than what we're used to talking about, but remember, we need our lungs to oxygenate our blood. Lungs not working good because of inflammation. The inflammation then is causing us to have a heavy clot burden, as we like to call it. And then you get clots that go to the large vessels of your head and neck. So then therefore it causes you to have, right, it's very scary, have these stroke symptoms. So remember, we got inflamed blood vessels. So we have more. You can have, sometimes they open up people in an autopsy and they got a bunch of little clots in their leg, they got clots in their brain, they got a bunch of clots in their head. Well, that's because the vessels are so inflamed that the blood vessels themselves may be so irritated that they cause themselves, they say, we just clot, we're miserable, we just clot. And like I said, it can cause deep vein blood clots, it can cause arterial blood clots. Arterial blood clots cut off the supply. You may have to get your leg cut off. Bettina Jones says, thank you for this real educational information. Yes. So heart attacks, what we said, strokes. So now you're seeing people less than 50 years of age having these strokes out of the clear blue. But sadly, y'all, they don't have any other symptoms that go along with the stroke. They don't have any coronavirus symptoms, that is, that go along with the stroke. So they may not have a fever. Their presenting symptom, guys, may be a stroke, right? So we have to be careful and watch your family members. Talk to your family members. Tell someone your symptoms, because a stroke is serious. You need to be getting some treatment within as few hours as possible. We need to get you in and be seen. And a lot of what we said here lately is don't go to the doctor. Stay out of the doctor. Stay out of the ER. But if you're having heart attack symptoms, if you're having stroke symptoms, if you're having shortness of breath and you can't breathe, if you're exerting, then please go to the ER. Please go get help, because everything should not be treated at home. So I think that that's something that we need to, as the medical profession, let you know that doctors are still there. The ER is still open. They have things in place now, and you know, wear your mask, get in there and get the help that you need. And lastly, make sure that you know the symptoms of a stroke. Okay? Make sure that you know a stroke, because if your family member is acting different, you can just say, you're not like, oh, they just clowning. No, something is wrong. And somebody put the acronym FAST. Fast. So that's how you can quickly realize if someone's having a stroke. So the F stands for face. Are they having any facial drooping, like their whole face? The eyes are drooping, the mouth is drooping. So is there asymmetry of their face? So fast, F-A-S-T. F is face. Are they having any facial droop? A is check their arms. Have them to hold their arms up. You see how level my arms are now, but if one side is drifting off and you like, no, you should not be doing like this. So if you're like, it's drifting and one side is over and you got a drooping mouth, so look for arms, and if they are even, if they're level, or if they're drifting. Okay, so F is for face, facial droop. A is for arms, looking for if they're level, or if they leaning towards one way or the other. S is for speech. Is their speech slurred? Is their speech slowed? Are they having problems finding words? If they're like, oh my gosh, I just can't. I know that that's a pencil. I know this is a highlighter, but I just can't call it. And they got a PhD, or if they knew what this was, a couple of days ago, you're like, okay, that's something that's not right. And then T is time. You have to act quickly. My dad had a stroke at my house, and I did not even think to call 911. I called ER and was like, we're on our way. And we took him. Don't do that, y'all. Don't do that. Call 911. Let 911, send an ambulance, get there, because they can get oxygen on them quickly. They can get vitals on there quicker than you probably can. They can do all of these things while you are en route. Because the timing of getting them from symptoms start to the residual that they can have can be devastating if you don't get help quickly. So my dad, we got him in. He started to have symptoms probably about 4 or 5. I woke up. I got up at 7, realized what was going on. He was at the ER by 8. So we knew, they were doing the testing. We had everything in line. He was flat on his back by 10 o'clock and on oxygen. And the oxygen helped to get oxygenated areas so that all the symptoms that he was having, he couldn't hardly walk. He had the droop on one side. You can't even tell any of that, but a lot of that was due to acting quickly. Now, back to the strokes that are happening with the coronavirus, affecting the large vessels going into your brain. Those ones can affect thinking, it can affect movement, it can affect breathing. So, we talk about profound deficits that you could be left with, that your family member could be left with. However, make sure to call 911, get to the ER, act fast, because if they need a clot buster, they need that to be the most effective and to get back to their baseline as quickly as they can, whatever their new baseline would be. They need that within 6 hours. So if you're just dragging your feet on, maybe they look right, maybe they don't look right, when in doubt, check it out, get them checked out. So within 6 hours, they need some medication, and at the latest, within 24 hours. So I always say within 6 hours or less, to be able to try and get back to their functioning selves as quickly as possible. So let's review it. High blood pressure is greater than 140 over 90. 2 times you have the diagnosis of hypertension. Major high blood pressure is major risk factors for heart disease, strokes, coronavirus. You already at risk for all of these things as it is, but now we're seeing how when you get the coronavirus, what happens to your high blood pressure. High blood pressure spikes up, you have this dizziness, you have lightheadedness, and you can have fainting. This has been seen, this has been reported. Dizziness, lightheadedness, fainting. This is not a time to run out your medicine. This is not a time to say, I'm going to just stop taking my medicine because I'm not stressed out like I was. Take your medicine. Also, buy a blood pressure cuff if you do not have one at home. If they say it won't be here until May 15th, and you got Amazon Prime, don't worry about that. Wait till May 15th to get it. Just wait and get it. And periodically check your blood pressure. People with coronavirus know that the coronavirus attacks their lungs. That's why they were really honing in on coughing and shortness of breath and wheezing, because you have inflammation. Inflammation attacks your lungs. Lungs fill up with fluid. Now the lungs can't do its job effectively and oxygenate your blood. So now you're sitting weak blood down to the rest of your body, like, hey, make my legs work. Hey, make me work, kind of thing. Make me feel good. Hey, help me think good because I got my blood going already. Hey, make me not feel tired. And your body's like, I'm trying to keep up, but it's so much inflammation in the lungs if you have coronavirus. And because of that decreased oxygenation plus the virus, you are at risk for having more clots. That being strokes, that being high blood pressure, that being DVTs or deep venous thrombosis, or systemic clots being thrown in your arteries. That's why the Broadway guy had his leg amputated. I think he had like arterial clot. So you're at risk for having that. So because your body's not oxygenated, it begins to make all these extra clots. Clots can break off and fly off, and you have like the perfect storm. But we're finding that the clots break off and go to your larger vessels that supply your brain. It affects thinking, it affects thinking, it affects movement, and it can affect breathing. So you talk about a profound stroke, not a little mini stroke, not a little bitty tiny TIA kind of stroke. You talking about we're gonna have to have some therapy. We may have to go to nursing home. We're gonna have to put in the work to try and get close to your baseline as you can. The inflamed vessels cause clot. And remember the signs of a stroke, guys. FAST is the acronym. F is for face, facial droop. A is for arms. Are you veering one way or another? FAS is for speech, if your speech is slurred or word finding is an issue, and time, act in a timely manner. Okay, guys? So, and remember, ERs are open, urgent cares are open. They are a big deal. Get in there to see them. A month ago, we were saying stay out. Now no one is going. So they're like deserts. You know, no one is going there. They're like dry places. So if you have symptoms, if you have heart attack symptoms, if you have stroke symptoms, if you have something that's indeed an emergency, a car accident, go to the emergency room. Wear your mask, guys. Remember we talked about that, but actually go. We have a question that says, I have diagnosed with high blood pressure, but it's controlled by medicines. Are my risks lower or non-existent as it relates to high blood pressure? We're being told that high blood pressure in general is a risk because a lot of times when people have high blood pressure, it originates in the kidneys and it revs your kidneys up. And one of the receptors that the coronavirus affects and attacks is in the kidneys, and very similar to that receptor, so the ACE2 receptor. So yes, having high blood pressure puts you at risk. Having diabetes, even if it's controlled, puts you at some risk, but having uncontrolled puts you at an even higher risk. Being obese, BMI over 40, puts you at higher risk. Not wearing your mask and being with someone that has on a mask is still a risk factor for you. It's not a risk factor unless I have on my mask to protect me and to protect you, and you have on your mask to protect you and to protect me. So I know that I'm in Alabama, guys, and they're easing into opening up businesses. I'm all for stimulating the economy. I'm a small business owner, so we're feeling the heat and that kind of thing, but err on the side of safety. If you do not have to get out, please stay in. If you have to get out, wear your mask. Parents, make sure your kids over 2 have a mask. Teach them the importance of covering their noses and their mouths in the short little time that you're going to be out there. Teach them that. So we're not going out to just kick it and we're not hanging out, because there still are some substantial time limits that they have on or crowd sizes that they have on, like nothing over 10 people for non-work related gatherings. But my advice is to stay home. If you have to go back to work and if your job is opening up this next week, then my advice is to stay home. Go to work, go home. Remember, take your clothes off and your shoes off in the garage or whatever. Spray the soles of your shoes with your Lysol, and then make sure to have your house clothes ready to be put on. Put your dirty clothes right into the hamper, especially if you've been out with other people. If you're walking in the park, y'all, wear your mask. Wear your mask. Wear your mask. Be safe out there, guys. Thank you for joining this edition of the Dr. Cree and Me Show. I am Dr. Cree. I'm your board certified family medicine physician. I help overworked, overwhelmed, nervous, and scared people learn more and more about their health and what's going on today and how to live a healthier, happier whole life. I feel like when we know better, we can do better, and it's my charge to teach you and to show you how to live better so you can do better. All right, guys, I'll see you next Tuesday at 2:30 for the next edition of the Dr. Cree and Me Show. You can follow me here on Facebook. That's at drcree.com. That's DOCTORKRE. Dr. Cree, and I'll answer any of your questions later on in the chat. I'll be looking at those. Dave, yes, happy that you made it. Good seeing you guys, and we'll talk later.